The aim of this video is to discuss the use of magnetic resonance imaging, also known as MRI scans. If you are having an MRI, we hope that this video will answer any questions you may have. You will also receive information specific to you and your scan from the hospital before your appointment, and it is important that you read through this thoroughly before your scan and follow any instructions that it may contain. You may have been referred for an MRI because you are feeling unwell, because your doctor wants to follow up some test results, or maybe as part of a screening or research program. You have been referred for an MRI because a healthcare professional who has reviewed your clinical history has decided that they need additional information, which can be obtained by using an MRI scanner to look inside of you. Before the MRI scan goes ahead, an imaging specialist will look at the request and decide whether it is the right test for you to have to find out why you are feeling unwell. They will then pass the request on to a highly trained radiographer to carry out the scan. MRI scans use magnetic fields and radio waves, which have shown no evidence of being directly harmful to humans. Most of the human body is made up of water, which contains hydrogen and oxygen. Hydrogen atoms have a proton at their centre, which are sensitive to magnetic fields. There is a magnetic field created in the scanner, which causes the protons in the body to all line up with one another, all in the same direction. Short bursts of radio waves are then used to knock the protons out of alignment with one another. When these radio waves are switched off, the protons eventually return back to being in line with one another again. As they do this, they release radio waves that are then collected and measured. Different areas of the body have protons in them that will take different amounts of time to return back to being aligned, and because of this, a computer is able to turn this information into a picture of the different parts of the inside of our bodies. To allow the MRI scanner to take images from different angles and areas of the body, the bed that you will be lying on for the scan will slowly be directed into the scanner by the radiographer before the imaging takes place. Depending on the scan and the area of interest, you may be positioned head first or feet first into the scanner. The MRI scanner will be long enough so that your whole body could fit inside it if it is needed, but it is open at both ends. All the components of the MRI scanner are hidden inside its casing, so you will not be able to see it. The scanner can be fairly loud, and you should expect to hear a ticking noise throughout your scan from the electric current being switched on and off. The sound and rhythm of the scanner may also change slightly throughout your scan. This is completely normal. You will be given earbuds and/or headphones during the scan to help block out that noise. Here is the sound of an MRI scanner while it's scanning. You should not expect to feel anything during your scan, but if you do feel any heating or warming of the skin, please let the radiographer know as soon as possible through the intercom system so that the scan can be stopped. During the exam, the radiographer will leave the room to operate the scanner, and the bed that you are lying on might move slightly again. The radiographer will be able to hear you throughout the scan through the intercom system, and also will be able to see you. So if you have any problems during the scan, you will be able to easily get the attention of the radiographers. They will also be able to communicate with you if they need you to follow any instructions during the exam and to check whether you are all okay. When you arrive for your MRI scan, you will first be asked to fill out a questionnaire regarding your health and medical history. This is so the hospital staff can further confirm that this is the right examination for you. You will also be asked if you have a pacemaker or any implants or devices inside your body, because it is extremely important to carry out additional checks and have more safety precautions for people with metal medical devices before they enter the MRI room due to the magnetic field. It is also very important that any items containing metal, such as watches, jewellery, hearing aids, are removed before entering the MRI room, and this will be checked by a member of staff before the scan goes ahead. This is because metal items will be magnetically attracted to the magnetic field of the scanner, which can cause them to malfunction or can cause projectiles to fly across the room, which can cause serious injury to both staff and patients. You will most likely be asked to change into a patient gown to make sure that none of your clothing contains metal, such as zips, buttons and underwire bras, as these also are not suitable to go into the MRI room. MRI scans can be carried out on individuals that are pregnant, but it is very important to inform the radiographer at your appointment if you know or suspect that you might be pregnant. This is because more safety precautions must be taken. It is not recommended to have MRI contrast agent injections if you are pregnant, so please let the radiographer know if you might be pregnant. Most people with tattoos will be completely fine during an MRI scan, but some tattoos contain small amounts of metal. This can cause heating of the tattoo during the MRI scan, so be sure to let the radiographer know if during your exam you begin to feel any discomfort or warming, and the scan will be stopped. Although the radiographer will leave the room during your scan, it may be possible to have a friend or family member with you in the MRI room for support. Just like you, they will not be able to enter the room if they have a pacemaker or any metal implants, and will be asked to remove any metal items from their body. Most MRI scans will not require any preparation, and after filling in your questionnaire and removing any metal items, your scan will be able to go ahead. However, for some exams, you may be required to have a contrast agent administered through injection, gas, or ingestion before the scanning begins. Contrast agents help certain areas of the body appear clearer on the images. You may require anaesthesia before the scan. This is uncommon for adults, and it is seen more often for babies and small children to help them keep still during the scan. If you do require anaesthetic, this will be given to you on a ward before you come to have your MRI, and you will be taken back to the ward after your scan for aftercare and monitoring. You will also need to bring someone with you to your appointment, as you will be unfit to drive and operate heavy machinery for 24 hours. If you do require any preparation, i.e. contrast agents or anaesthesia, this will be detailed in the information sent to you from the hospital before the scan, so it is important that you read through this beforehand to ensure you are fully prepared for the scan to go ahead. Most MRI scans will take between 30 and 90 minutes, although your appointment time may be longer than this if you need some type of preparation before the scan takes place. In most cases, you will not have to stop eating, drinking, or taking any of your medication before your scan, but you should always check the information your hospital sends to you to ensure that this is the case for your scan. If this is not the case, instructions on how many hours to restrict food and drink for and what medication you need to stop taking will be detailed in this information from the hospital. When it is time for your scan, the radiographer will lead you into the MRI room and talk you through what is going to happen. You will then be asked to put on earplugs and headphones and asked to lie back on the bed. It is important that you get in a comfortable position, as you will need to remain still throughout the scan to avoid blurring in the images. Cushions will be available for you to help you get comfortable if needed. You will then have a laser light put over an area of your body to help position you correctly in the MRI scanner. You must not directly stare at the laser light because it will cause a dazzling effect in your eyes. The radiographer will then slowly move you in the bed into the scanner and leave the room. They will then ensure that you can hear them and that they can hear you through the intercom system before the scan starts. As mentioned before, scans can range between 30 and 90 minutes, and you may need multiple scans during your visit. You will be told through the intercom system when each of the scans are about to start. You may be asked to hold your breath for a short amount of time during certain scans, but this will be discussed with you both before any scanning takes place and will also be announced over the intercom system so that you know when you need to hold your breath. If you think you may struggle to hold your breath, just let the radiographer know before any scanning takes place. If you require a contrast agent to be administered before your scan, it will be determined by a healthcare professional beforehand if it is suitable for you to have. The most common type of contrast agent used for MRI scans is gadolinium, and it will be excreted in your urine by your kidneys after your scan. It is important that you inform the MRI staff on arrival if you are allergic to gadolinium, or if you have any other allergies, or if you are pregnant, if you have reacted previously to a contrast agent, or if you are on renal dialysis, have problems with your liver or kidneys, are seeing a kidney specialist, or if you have had problems with blood clots in the past. Gadolinium can cause some mild and short-lived side effects, such as pain at the injection site, similar to what you would experience after a blood test, a change in sensation, itching, developing a rash, tingling or warming of the skin, or headaches. Allergic reactions to MRI contrast agents usually occur immediately after the injection, but if you do experience any of these side effects, or if you do develop any symptoms associated with an allergic reaction, i.e. swelling of the face, tongue, hands, feet, or any trouble breathing, please do let a member of staff know as soon as possible. Gadolinium contrast agents can have serious side effects, such as nephrogenic systemic fibrosis for anyone with impaired renal function, so it is important to make the radiographer aware if you might have any kidney disease. As mentioned previously, on the condition that all safety precautions have been taken and metal has been removed, MRI is thought to be safe and does not have any known long-term side effects. The research that has been done around the subject has not shown any evidence of detriment to health from having an MRI scan. Projectiles, due to the magnetic field, present the largest risk, and to minimise this, there is extensive screening carried out before the scan to ensure that no metal items are taken into the MRI room by mistake. At all stages in your care, everyone works together to reduce the risk as much as possible and to ensure you have your clinical question answered.
As the referrer, I ensure that I have a clinical question that I need the answer to in order to provide the best possible care for you.
As the radiologist, I ensure that the benefits to you are greater than any risks before I allow the scan to go ahead.
As the radiographer, I make sure that the risks are minimised as much as possible and make the most of my equipment to get the information to answer your health question.
As the radiologist, I provide a report that answers the referrer's question.
As your doctor, I can now decide on the best way to look after you, my patient.
Whilst the radiographers are highly trained, it will be another member of staff, usually a radiologist, that will report on the images. Therefore, they will not be able to provide you with any indication of the results at the time of the appointment. A report will be provided to your referring doctor following the scan, who will go through the results with you and discuss with you any plans for future treatment. As mentioned throughout the video, your hospital will provide you with information on their specific requirements. Feel free to contact the department before your appointment or mention to a member of staff on arrival if you are claustrophobic, as they will be able to give you some reassurance and make sure you are as comfortable as possible for your scan. Further information on MRI scans can be found in this leaflet or on this website. We hope that this video has answered your questions. However, if you would like to make any suggestions for future improvements, please see this website.